great to have everyone here. My name's Matt McCoy. I'm a state senator from Des Moines, and it's our pleasure to present to you Iowa's public option as it relates to health insurance. And we're really here today because of the crisis in healthcare and the fact that 72,000 Iowans now have only one choice in the marketplace as a result of a variety of issues. But that one choice in the marketplace, according to Money Magazine, will be one of the most expensive insurance policies available in the nation. In fact, we anticipate a 69% increase, according to Money Magazine, in people's premium rates. So, for example, I had a family from Mason City, a family of 4 from Mason City, that would now be responsible for paying over $2,200 a month for what would be considered a silver plan in the marketplace, which is a basic insurance policy, and it would have a $12,000 deductible with it. So that's what Iowans are faced with, and Governor Reynolds pulled out of the stopgap measure that she and the insurance commissioner had put forward as a proposal, and she blamed Obamacare. Well, the fact is that Donald Trump personally heard about the stopgap measure and made sure that that stopgap measure could not move forward. And so the fact is that, we have to work together in a bipartisan way to find solutions. We've watched Congress fail to act. Congress has had the opportunity to move forward with comprehensive fix to Obamacare to try to shore up the marketplace, and all they've done is sabotage Obamacare and sabotage the ACA, and as a result, we've limited Iowans' choices. And so that's really why we're here today, and I'm going to let Representative Forbes talk a little bit about what we're proposing.
Thank you, Senator McCoy. Well, I'd like to first of all, thank our colleagues from both the House and the Senate for joining us here today. Thank you for your support. The insurance industry here in Iowa is in a crisis, especially for the 72,000 Iowans who are going to have a drastic change in their insurance benefits come January 1st. As you're aware, 3 companies were in the marketplace. We're down to 1, a company named Medicaid, and we have some deep concerns about what impact the premium increases are going to have on Iowans here. We're hearing somewhere in the 60 to 70% increase, which is going to be unaffordable for most everybody in the plans today. Put on top of that are the co-pays, the deductibles, and people may be able to afford insurance, but they aren't going to be able to afford to go to the doctor because they won't be able to cover all the deductibles and co-pays. So we have put together a piece of legislation that hasn't been filed yet that will address this issue here in the state of Iowa. First thing we're going to do is we're going to clean up our state Medicaid program. We're into about an 18-month experiment with our state Medicaid program, and it's been a disaster. You've probably seen in the media, on TV, radio, print, the countless stories of Iowans who are at risk or who have died because of our state Medicaid program, because of being denied services that they were getting prior to us switching to a managed care system in April of 2016. So our bill will take us back to our old system, a system that worked very well. I served on the Human Services Budget Subcommittee, which oversees our state Medicaid program, which is over, I think this year it's going to be about $4.3 billion. And Iowa was really a model for other states, how we ran our state Medicaid program. And the governor, on a unilateral position, dismantled it all at once. And we've had this experiment now, like I said, for 18 months, and it's time to go back to our old system that worked, that provided care to Iowans, that provided quality care, that would pay providers for the services. One of the concerns we have are smaller providers in the rural areas of our state are going out of business because they're not getting paid by the MCOs. And now this week, if you heard, one of the 3 MCOs is dropping out. That puts 213,000 Iowans now without insurance. Now they're going to get transitions to a new program, one of the two other MCOs. But we're very concerned with 28 days to go before the 1st December, how that is going to occur, and where we're not going to see lapse in insurance coverage for our most vulnerable citizens. So we're going to work hard to make sure that that is in place by the 1st of December. I also serve on the Medicaid Oversight Committee, which is going to meet this coming Tuesday, November 8th. I think maybe it's Wednesday, I'm sorry. I can't remember. Well, it's Wednesday, November 8th. And we're going to ask the tough questions to the 3 MCOs that will be at our meeting to make sure that the transition is as smooth and as seamless as possible. So with the support of our colleagues behind us, and hopefully bipartisan support from the Republican caucuses in both the House and the Senate, when we get back to work on the 2nd Monday of January next year, we will take up this bill and get this moving forward so we can do what's right for Iowa citizens.
So this bill will essentially provide coverage for people between 138% of poverty to 400% of poverty. In addition, this bill will allow individuals to apply their ACA credits towards the purchase of whatever the cost ends up being for this Medicaid plan. We know that we expect to save about $200 million at least, possibly $300 million, by bringing back the privatization of the Medicaid system, and that money will be applied directly to insurance premiums for individuals that are trying to buy their coverage at a more affordable rate. And we know that this is a plan that has passed the Nevada legislature, overwhelming vote of the Nevada legislature, and their governor, Republican governor, vetoed this plan, and they're going to go back and try to pass it again. In Washington, there are 26 Democratic senators that have signed on to a plan for expansion of Medicare for all, and so this is a novel idea. I think a single-payer system with a public option that gets us closer to where we want to be, which is making sure we provide coverage for all Iowans, and for those people that are out there doing those difficult jobs, the service providers that rely on a good system to pay them, and we currently don't have that. We have Medicaid companies, MCOs, that are operating and not paying providers for the work that they're doing, and many of our providers are going bankrupt or exhausting their lines of credit. And so it's created a very difficult situation throughout Iowa, and we know that we have to all work together to solve this problem. It's going to take a lot of smart people working together and I think pulling the wagon to make this work. So be happy to take questions. Senator Dandekar joined us. Hey, thank you. Oh, Representative Jacoby, I'm looking into the light. Very good. Yeah, holy smokes.
Would any of our members like to make any comments on?
Yeah.
I just wanted everybody to know, too, this is not a partisan bill. We're extending our hand to Republicans in the House and Senate and the governor to work with us on an alternative. This is an alternative that Democrats have put forward. The governor submitted a stopgap measure, one measure, and it was not received well by the Trump administration. And so they've thrown up their hands, and they've pulled that. So we don't have an option. This is a workable option that could be the beginning of bipartisan work on a bill where we can help our own Iowans take care of their medical health care. So I want everyone to know that. I want to know we extend our hand, and we would love to be involved with bipartisan work on a bill. Thank you.
Scott?
So now, if we were to once again take over the Medicaid, how long would it take to ramp up the infrastructure to be able to actually start processing claims and making sure that our providers are being paid in a timely manner?
Well, right now we have the infrastructure somewhat in place. It wasn't totally dismantled. We still have some fee for service in the state of Iowa. It's a very small percentage. but Iowa Medicaid Enterprise, which is located in Des Moines, I think they have about 400 employees there, if I
Yeah.
recall, would be able to probably get things back up and running. Now, I can't give a specific date, but even if we were to, when this bill passes next, hopefully by March or April, we would then have to work with CMS to get the waivers that are required, a waiver, I think it's 1332 waiver. So we're looking at probably realistically almost a year before we'd be able to get this program up and running in our state. So that would give Iowa Medicaid Enterprise time to ramp up, get things back in place, and be able to start working with patients across the state to deliver services.
And a lot of the employees that went to work for the MCOs would then be able to come back and work for the state again if we brought it in-house. So it really would not be a major undertaking or a training curve. It is, we've got a good group of well-qualified employees that can make the system work more effectively and more efficiently. Yes, sir.
Do you have any indication that Republicans will work with you in passing this legislation, or is this just kind of a shot in the dark?
Well, you know, I have had in the last 2 days, and I can't give names, but I've talked with 2 Republican senators about this plan, and they're all both very interested in looking at it. So that's a positive sign. And I've also had conversations with one of my Republican colleagues in the House, and this individual too is very interested in looking at it. So I think as this gets more and more force behind it, I think you'll see Republicans really taking a close look at it, and hopefully we can get into a bipartisan type bill, because this shouldn't be a partisan type politics. This is healthcare. We're talking about people's lives here. And if we don't act, the people in the state of Iowa are going to suffer. And they're suffering right now under our current state where we have the managed care systems. So that's why as legislators, we're here to find the solution for our fellow citizens. And we think we've got it right here. And we are asking our colleagues on the Republican side to join us. And if they have positive input, I mean, we're looking for all suggestions we can get. And if we can make this bill better, we'll work at that too.
Yeah, and I just say, you know, we received a strong vote of encouragement. The editorial board of the Des Moines Register endorsed the idea. Fred Hubble will announce today that he's endorsed the idea for a good option to move the state forward. So I think that this issue will find its way into the governor's race very quickly as a result of that. And I think that's ultimately what we need to do is we're the spark. They're the flame, we're the spark, and we're trying to spark a fire and get something going. And ultimately, my question would be to Republicans would be, why not? Why can't this work? And specifically, you know, what about this is unworkable? Because I think we've indicated the savings is there. The feds are already reimbursing Iowans $360 million through the ACA between 138% and 400% of poverty for the credits. And these 72,000 Iowans are going to, in essence, be volume buying through joining a Medicaid plan that's already discounting and receiving the volume purchasing prices that other consumers in the marketplace, 1 in 5 Iowans, are already receiving. So I think this is a workable plan, and I think it's an idea that even Republicans should find as a way of covering Iowans. And we're going to find out what their constitution is as it relates to Iowans. If they're serious about taking care of those 72,000 Iowans that are left without a lot of choices in the marketplace, then they're going to get on board this.
I wanted to say that I do know Republican colleagues that are concerned about this issue too, to know about the critical nature of it. There's a lot of noise right now and a lot of politics, so we're hoping that the leadership will see that this moves and that we can get all of our colleagues together developing a bill that will work. Thank you.
Yes.
how would premiums be determined?
So premiums would be determined upon two factors. The first factor would be experience. What is the experience of the group? And in essence, the actuarial, in other words, what are the real costs of administering the program? And then it would be based or divided based upon the population of the pool and the population. And there's some other factors that may or may not be considered, including age and income and other factors.
And then who would be setting those premiums?
Those premiums would be determined and established at the beginning of the year based upon actuarial and real experience, and then ultimately reviewed by the actuarials would be reviewed by the insurance commissioner, and that's where those prices would be set.
One of the things that we've really focused on too is administrative costs. We ran our state Medicaid program prior to going to managed care for about a 4 to 5% administrative cost. The MCOs have around a 12 to 15% administrative cost. So if you do the math, it's around $300 million more a year we're currently paying than we were previously. And that's part of the problem where we're running into all these issues with the MCOs saying they're not making any money, we're not paying them enough. It was all based on probably the states running it on about a 4 to 5% administrative cost, where they have all these extra costs built in that they're paying their shareholders and they're paying their CEOs. Well, we don't pay shareholders, we don't pay CEOs in the Iowa Medicaid program. So we envision about at least a $200 million savings, and it could go up to 300 to 350 million.
Just on the administrative side.
On administration.
Now, that isn't touching what we're going to get in terms of we're buying pharmacy at a discounted rate because of 600,000 Iowans that are negotiating their rates as a unit. So collectively, we're going to do a lot better. Yes, sir.
Maybe my memory's bad, but I thought Governor Branstad told us that we'd save money if we did what we're doing, and y'all are saying we're going to save money. It sounds to me like the marketplace for dealing with health care does not work. What we had before Obamacare didn't work. It was driving people into bankruptcy too. And we've got one candidate for governor who's suggesting that we ought to have Medicare for all, or single payer here in Iowa. So I wonder if you're going to take us forward by taking us back. Why don't you take us forward by taking us forward and dealing with something that will really help people instead of promising that we're going to save money, then actually provide health care.
Because I live in the real world, and in the real world, that isn't possible right now. As I indicated, there's 26 Democratic senators in Washington that are collectively engaged in Medicare for all, and they want a single payer system, and that is ultimately, I think, going to be where we need to go. But we're not there yet today, and we have to work with the GOP governor, the GOP House and Senate, and so we're trying to do it within a system that right now is broken, and we're trying to make it better. And ultimately, you've got to walk before you crawl, and or you crawl before you walk. You crawl before you can walk, and so we're trying to crawl our way to a better system. But if I were just speaking as a state senator from Des Moines that happens to believe in single payer universal health care, I would be on board the concept of pushing that forward. The real world isn't going to allow that at this time.
I have a question. Do you think if you just came out swinging for that more, what's called progressive option of single payer healthcare, that would inspire people to rally behind in the way that you saw the fight against, a lot of
So I really think I would need to be in Congress or in the United States Senate to propose a single-payer system.
I mean, for Iowa.
I mean, I just can't envision that we would get something like that approved at the state level, is what I'm trying to say, because our system is so dependent upon the federal system, because all of our funding flows through Medicaid. So it's federal money that flows through the Medicaid system to the state, and then the state then has to determine how those programs are administered. And in fact, that's kind of what we're trying to do, is work to preserve the federal funding through Medicaid and cover more Iowans at a lower cost right now. But for a single payer system, if I were in the United States Congress or if I was a United States Senator, that would be something that I could certainly work towards. And I think that universal care is where most of us, a lot of us, would like to go.
Are you guys talking about, are you, I guess, mingling that conversation of a single payer at an Iowa level with the conversations that you're having?
Yeah, when Joni and I have ice cream, I'm just kidding.
Yeah.
We are like in different worlds on that issue, and they are working to. They voted to repeal Obamacare without a replacement, and they want to block grant the states, which means they're going to just absolutely decimate. And right now, we only have one Democrat in Congress who I'm supporting that is still trying to do something on health care and still trying to do something on Obamacare and undo some of the sabotaging that's going on at the federal level of Obamacare right now.
I'd like to offer an additional perspective as it relates to the question of how can we use this opportunity to move our system forward rather than the perception that we're going back. One of the fundamental principles of what underlied, I think, the decision to privatize Medicaid is the notion that competition would make this system better. So we got 3 private insurance companies competing and basically dividing up the market, which creates inefficiencies. It was sold on the idea that we could get the best care at the right time, the right place, the right price. But instead, in order to meet the bottom line, the managed care companies have to put in all the things that go against that. Prior authorizations, make contract with the providers willing to do it with the least, delayed payment, cutting services, all the things that also make, frankly, the delivery system providers mad, in addition to the payers and legislators, et cetera. So one of the things that we've seen actually in the last 10 to 15 years, and I've been working in this through a group in Dubuque called the Tri-State Healthcare Coalition, is the medical care system, in part through incentives put together in the ACA, is developing evidence-based protocols whereby they can compete based on the quality and value of the service they provide. In other words, get more for the money that we're putting into the system. And those are standards that, science-based, science isn't really popular these days in politics, but those are common denominators that the system across the country and across disciplines, and it's a very transparent system, and there are folks within the medical community, Iowa Healthcare Collaborative and others, that have been moving in this direction. So this plan that our leadership is putting forward that you see here today really creates an opportunity within our Medicaid system to take advantage of those dynamics that will have real opportunity to drive down costs, but also improve value for the patient and get rid of all the headaches.
Yes, is there more detailed break down the numbers, especially the number of enrollment, the finances that's could be added to this?
Not yet. See, that will come after the bill is actually filed, and then we can actually get a legislative fiscal note worked up on the bill, and that will actually come as the bill, since the bill hasn't been pre-filed yet.
Well, I don't have any doubts about that. Is there a specific model from another state system that you're using?
Well, this is a model that, this bill actually was the bill that Nevada passed almost word for word.
Okay.
And Nevada is going to try to pass it again this year and force their governor to sign it, because their governor vetoed it last time it passed both the House and Senate. And so other states are looking at this model because no state wants the feds to do the block grants and try to force money down to the states, because it'll be about 2/3 of what we're currently getting, and it'll leave a lot of people behind.
What possible defense do people use for the current system? I mean, you know, we had some court trials,
Yeah.
but they're gonna fight this. They're
So
gonna
the
say
three things,
that it was a good idea.
the three things the governor said it would do was increase competition, lower healthcare costs, and provide a forum to ferret out fraud, waste, and abuse. So far, it has increased our cost significantly. We just learned that there's going to be an additional $140 million needed to feed the current system. In addition, the fraud, waste, and abuse that they've actually found is almost, it's 0.2%, which is, according to the federal Medicaid folks, they said it's like negligible, it's zero. I mean, we really don't have fraud, waste, and abuse in Iowa. And the third thing, they're not measuring yet because they haven't put any measurements in place. But those are the three things that they talked about when they said, when the governor made the decision to unilaterally move in that direction. But he is not standing behind those things. She is not today standing behind those things as reasons to support this program. And to be honest, I don't think she's been around when the hard questions have been asked. When AmeriHealth pulled out of the state, she arranged her schedule so that she would be at a child care ribbon cutting on the other side of the state. And she took press that day from Ames. And so she took the press in the morning and didn't have the event until the afternoon, and there was no press availability. So whenever tough decisions are being made, she's finding herself out of the metro, out of the area where reporters are.
So is that a plus or a minus to trying to get Republican members on board?
I think that members are looking for solutions, and I think Republicans and Democrats are going to have to look for solutions in a way that we can work within the confines of the state and federal policy, and so I think it's a plus. I think we can do this. I think we can do this in a bipartisan way. We've done all kinds of things in Iowa that have been leading in terms of national best practices. Our Medicaid system was a national model. People came in and looked at our Medicaid system and tried to emulate it in their own states. We set that model up separate and apart from state government. It was its own enterprise. And Governor Vilsack did that because he believed in the power of that enterprise to operate independently from government bureaucracy. And so it was a model, and as Representative Forbes indicated, it was working at about 4%. So we ought to go back to that model. It worked.
I think the other dynamic that we need to see is that to answer that question isn't just up to people like us. It's up to people like you willing to make direct contact with your own legislators who maybe aren't here. Because the more they hear from constituents regarding how the system is not working as intended, and how the promise of the system, how it should have been working in areas that we supposedly weren't being affected before, those promises have not come to fruition, you will arm them with the information and the nerve they need to go to their leadership and say, hey, we need to look at this, or come up with our own solution, which we're also not seeing, because the status quo is untenable. I'll just give you one good example of an issue I'm working on, along with Representative Forbes and others, that where a managed care system, if implemented effectively, could do us a lot of good in this state, and it's all around drug abuse, addiction and dependency, specifically the opioid heroin epidemic we've seen. Mental health and substance just use disorder treatment, we've been all over the map historically in terms of where you can get it, whether it's working, whether the providers are there to offer it, whether we pay for it adequately. A unified system such as the one we're talking about, under managed care, can bring the resources together statewide and allocate them wisely so that we can actually help treat people who need that. And by the way, it benefits to other aspects of government, such as our correctional system and our child welfare system. Benefits to that would be huge as well. So a managed care, if a system, if implemented wisely, could do us a tremendous amount of good in various areas of healthcare. But that's not the dynamic that was created with Medicaid privatization at all. Those companies have not been incentivized to go out into the wilderness, so to speak, where no man has gone before, and try to address issues like that. And had it been done correctly, that's exactly what they should have been doing, based on the promises that were made by the governor.
Well, thanks for coming, and thanks for your interest in this subject. We'll continue the discussion and dialogue as we get into session. Thank you.